The member for Melton.
Thank you, Deputy Speaker, and congratulations to you on your elevation to the Deputy Speaker's role. Deputy Speaker, I rise today to contribute to the Mental Health and Wellbeing Bill 2022, and it's always good to follow the member for Hawthorn's contribution, and I thank him for that. Of course, the handing down of the Mental Health Royal Commission has been a pivotal moment in Victoria's history, and the reform that has been desperately needed by sufferers and the people that surround them can never come soon enough. Former Minister for Mental Health noted in his second reading speech that there are three core foundations necessary to achieve success in this reform, and they are the workforce, the legislation and large-scale sustainable investment. And today's bill helps deliver the legislation component to the investment this government has already made financially and in this critical workforce. This bill is a comprehensive bill, but differs from the 2014 Act, and it sets out a fresh foundation for the new mental health and wellbeing system, and looking beyond issues of compulsory treatment and restrictive interventions, which dominates the existing legislation. This is an unapologetically aspirational bill, and in keeping with our bold and aspirational commitment to the Victorian community to deliver on every single one of the Royal Commission's recommendations. And the Royal Commission into Victoria's mental health system was unequivocal, and that our system was broken and failing Victorians. And the final report laid out a blueprint for building a compassionate and effective mental health and wellbeing system from the ground up. And while the Commission undertook its important work, we did not stand idly by, with a record investment of $869 million in November 2020 to address critical demand and improve the mental health system while we awaited the final report. In total, we've invested more than $252 million in additional mental health support since April 2020 to help meet demand and ensure Victorians get the care that they need during and well beyond the COVID-19 pandemic. And this was in keeping with expert advice on how to best manage traumatic events such as this pandemic that we've all gone through over the last 2.5 to 3 years. So also in the record-breaking investment, the 21-22 state budget provided an enormous $3.8 billion to kickstart the next decade of mental health reform, and it was focusing on funding for services to provide greater clinical care and community support services to Victorians in need. We then backed that in through the 22-23 budget with another $1.3 billion of further investment and building out on the foundations created the year before and continuing to build the momentum necessary to fully deliver on the Royal Commission's outcomes. And this investment will be the turning of the tide for mental health in Victoria, and this government is immeasurably proud to be the one to deliver it. Of course, to achieve great outcomes, that can't happen overnight. And in order to secure the future of Victorians' mental health system, we need the opposition to actually come to the table and to explain how they intend to continue this vital work. And if not through sustainable funding mechanisms, including the mental health levy. So some of the highlights of the record $3.8 billion through the 21-22 state budget investment include $954 million to reform area services to better support the mental health and wellbeing of adults and older adults. $264 million for 20 new local services for adults and older adults, supporting people in their communities. A further $266 million for supporting the mental health and wellbeing of young people. $196 million to support the mental health and wellbeing of infants, children and families, and $370 million for new models of care for bed-based services that are safe and compassionate. $173 million for a government and community-wide suicide prevention and responses, and $218 million for mental health reform in education, setting up children and young people to thrive. And of course, in Aboriginal mental health and social and emotional wellbeing, we provided $116 million and $141 million asset funding to expand mental health treatment options for Victoria's youth. So the 2022-23 Victorian state budget is investing $1.3 billion for brand new initiatives which will build on last year's record investment of $3.8 billion. And we could rattle on about more and where the money's going to improve the mental health services. But one important area that needs to be highlighted is the $372 million for workforce initiatives, which includes training an additional 1,500 mental health workers, including 400 mental health nurses, 100 psychiatrists and 300 psychologists. And an additional $490 million in acute hospital-based care, which includes 82 new mental health beds in key growth areas such as the Northern Hospital and the Sunshine Hospital, obviously that's in the electorate of the Deputy Speakers. So these are great initiatives in spending in regard to trying to assist the Victorian community with their mental health issues. Since the Royal Commission's report, over 2,500 mental health jobs have been created in Victoria, delivering on exactly what our mental health workforce strategy identified as necessary for this reform. And for without caring mental health workers, there can be no mental health system at all. Professor Pat McGorry, Executive Director at Origin, welcomed the investments as an outcome of the Royal Commission and reflected that this approach will mean that Victorians, and in particular young Victorians, will be able to bounce back from the adversities experienced over the last 2 years and go on to lead healthy and contributing lives. And of course, this is just the start of a 10-year journey, he says, and we are committed to long-term mental health reform that will benefit all Victorians for generations to come. Our job now is to overhaul our mental health system and win back the trust of those Victorians who need our help and support. And this should not have to be a partisan solution, but until those opposite similarly commit to implementing a single recommendation of the Royal Commission, we are the only ones Victorians can rely on and really count on in this state to improve the mental health situation. So, despite the dedicated work of the Royal Commission into the Victoria's mental health system, and despite the thousands of expert witnesses, formal statements and informal contributions from across Victoria, the opposition will still not commit, as we have done, to implementing all of those recommendations that the Commission has tabled on this life-saving outcome. So one bit of the expert advice they particularly refused to acknowledge is in relation to the creation of a dedicated mental health levy. And as recommended by the interim report of the Royal Commission, this initiative recognised the considerable struggle mental health services have faced in receiving sustainable, ongoing funding sources in our crowded health sector. So investing in mental health is critical, as we all know, and I'm personally pleased to see this government investing in the mental health and the workforce that surrounds it. And as an ex-paramedic, I can assure you that so much time of our hard-working first responders is used providing care and support for those struggling with mental trauma. And it's been, in the past, disheartening to see the same individuals, time after time, getting to a point where their only option is to call out a paramedic. We should never let mental health get so bad that for many, that is their only option available to them. It's also smart to reduce the pressure on our first responders by dealing with the mental health issues at the core, and it's the same as we hear about reducing pressure on our public health system by investing in the GPs. And we need to have a smarter approach to the way we treat people physically and mentally, and to provide better outcomes for patients and to reduce pressure elsewhere in the system, such as our first responders. And my experiences as a paramedic and as the ex-secretary of the Ambulance Union, I've seen many paramedics suffer with mental health injuries over the years. And in fact, in my 38 years working in the ambulance industry, unfortunately, I know of 23 paramedics that took their own lives. And some of those paramedics were my work colleagues. I knew every one of those 23 paramedics, and I'm pleased to say that things have improved, but we've got a long way to go. This bill is a vital piece of reform as we seek to continue to work as highlighted in the Mental Health Royal Commission. I want to thank the previous minister and also the ministers that have done a huge volume of work in these reforms. I support these reforms, I support this legislation, and I commend the bill to the House.